In today's video, we will learn nearly 50 plus 2026 most common HCC coding interview Q&A. So, if you want to get successful in HCC coding interview, please watch this video until the end. And after watching this session, if you feel this session is useful for you, please click on like button. So our first question is, what is HCC? So HCC means hierarchical condition category, is a risk adjustment model used to predict healthcare costs based on patient's disease burden. So if the patient is having less disease, less risk adjustment. Okay. If the patient has more disease conditions, patient is having more risk adjustment costs. So it is based on patient's conditions. So less disease, less cost. More disease, more cost. Next, what does HCC stands for? So HCC stands for hierarchical condition category. Okay. So who developed the HCC model? So basically HCC model is developed by CMS. So Centers for Medicare and Medicaid Services. So basically what is the purpose or use of HCC coding? So the purpose of HCC coding is to ensure accurate risk adjustment and reimbursement based on patient's complexity. Okay, so basically this model will adjust the patient's or physician reimbursement based on the patient's complexity. So if the patient is having less conditions, less reimbursement. If the patient is having more conditions, as physician needs to provide more treatment or more service, patient will get more reimbursement. Okay. So what is risk adjustment? A method used to adjust payments based on patient's health status. What is REF score? So REF means basically risk adjustment factor representing patient's disease burden. Next, what factors influence REF scores? Basically, these are the factors which will influence the patient scores. Basically, age, gender, diagnosis, disability status, as well as Medicaid eligibility. So next, does a higher REF score mean higher patient risk? Yes, obviously, yes. Means if the patient is having more chronic conditions, patient will have higher REF score. So here patient will be at higher risk. Okay. Next, what happens if chronic conditions are not coded? So REF score decreases and reimbursement may be reduced. So that is the reason we need to capture all chronic conditions from the documentation. So how often must HCC conditions be reported? So basically we need to report every patient's HCC conditions annually once. Okay. So what does MEET stands for? So MEET means monitor, evaluate, assess and treat. And also if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery training, IPDRG training, HCC coding training, CCS certification training, please send WhatsApp message to 707-526-3939. So next, why is MEET important? So it supports medical necessity and validate diagnosis coding. So complete HCC coding depends on MEET concept only. Okay. So using the MEET, we will support medical necessity and validates diagnosis coding. Okay. So next one, can diagnosis be coded from medication list alone? So we will not code diagnosis from the medication list. Physician needs to document the diagnosis or condition also. So can you code history of condition as active? So no, unless the condition is currently active. So if the patient is having previous history of breast cancer, where you need to check the documentation for whether patient is having mastectomy or not. If the patient is having the mastectomy, you can't code active, you need to code it as history. Okay. or rule out diagnosis coded in outpatient settings? No. Okay, inpatient setting we will code this rule out diagnosis, but in outpatient setting we will not code. So next, what is hierarchy in HCC? Okay, so only the most severe condition within a disease group is encountered. As all of us know, HCC is based on hierarchy. Okay, where most severe condition within a disease group is counted once. Okay, so next, diabetes with complication versus without complication, which is captured. Diabetes with complication. So basically, we will not code diabetes without complication if the documentation contains diabetes with complication. So next one, CKD stage 3 and ESRD document together, which counts. So as based on HCC coding or medical coding guidelines, we need to code more severe condition. Here among CKD stage 3 and ESRD is more severe. We need to code it as ESRD. Next, active cancer versus history of cancer, which is counted. So active cancer. So we need to check the documentation, whether patient is having any current treatment using the radiation therapy as well as anti-cancer drugs. So we will code active cancer based on documentation. Next, acute MI versus old MI, which counts. So acute MI counts whenever documentation contains acute MI as well as old MI. Okay. Next is diabetes with complications in HCC condition. Yes, of course, diabetes with complication like diabetes with CKD, diabetes with neuropathy, diabetes with polyneuropathy, diabetes with any other circulatory conditions comes under diabetes with complication. Okay. Is COPD in HCC condition? Yes. So COPD is the most common HCC condition. Is hypertension alone an HCC condition? No. So basically, hypertension alone is not a HCC condition. If you want to consider hypertension as HCC condition, patient needs to have CKD or heart failure. Okay. Is heart failure an HCC condition? Yes. Heart failure as a HCC condition. Is morbid obesity captured in HCS? Yes. Morbid obesity is a HCC condition. Does E11-9 map to an HCC? No. Next, does diabetes with CKD map to HCC? Yes. As we have discussed, so diabetes with complication maps to HCC condition. So is diabetes neuropathy an HCC condition? Yes. Okay. Is diabetic retinopathy captured in HCC condition? Yes. So if diabetes is documented as controlled, should it be coded? Yes. Okay. Is unspecified CHF an HCC condition? Yes. Next, is atrial fibrillation HCC condition? Yes. Why means it is a chronic condition. We need to consider it as HCC condition. Is stable angina in HCC condition? No. So stable angina does not come under HCC category. Does COPD with exacerbation capture HCC? Of course, yes. So COPD without exacerbation is also like HCC, with exacerbation also HCC. Basically what we need to understand, COPD unspecified is also one HCC condition. Okay. So is respiratory failure as HCC condition? Yes. So is CKD stage 3 an HCC condition? Yes. So is CKD stage 1 an HCC condition? No. Okay. Should dialysis status be coded? Yes. All status codes needs to be captured. Does ESRD map to HCC condition? Yes. Should diabetes and CKD be linked if documented? Yes. Okay. So could you please explain what HCC stands for? So HCC stands for hierarchical condition category, which is a risk adjustment model utilized to forecast healthcare expenditure by considering patient disease burden. Okay. Next one, what is the full form of HCC? So as we have discussed previously, full form of HCC is hierarchical condition category. What is the primary objective of the HCC coding? So the main purpose is to ensure precise risk adjustment and appropriate reimbursement taking into account the complexity of the patient's condition. So could you define risk adjustment? So risk adjustment is a methodology employed to modify payment based on the health status of the patient. So if the patient is having less severity, less risk adjustment. If the patient is having more severity, more risk adjustment. What does RAF score represent? A RAF score or risk adjustment factor indicates patient disease burden. So more score means more conditions or more diseases. Less score means less conditions as well as less disease burden. Okay. So what element contributes to RAF scores? So as we have discussed previously, age, gender, diagnosis, disability status and Medicaid eligibility all influence RAF scores. Does an elevated RAF score slightly greater patient risk? Of course, correct. Yes. So what are the implications of chronic condition not appropriately coded? So the RAF score will decrease, potentially leading to a reduction in the reimbursement to the. So what is the required frequency for reporting HCC condition? As we have discussed, it is annual. What is the significance of MEET? It substantiates medical necessity and validates diagnosis coding. Okay. So when both acute MI and old MI are present, we need to consider it as acute MI. So thank you team. Thanks for watching this video. So if you like this video is helpful for you, please click on like button. And also if anyone looking for surgery, IPDRG, HCC, CCS training, please message to 707-526-3939. Thank you.